Welcome to Round Robin. I'm your host, Robin McCormick with the City of Hampton. And today we are going to remind you about hepatitis, what it is, how to get screened, who should get screened. My guest is from the Health Department, Nancy Lemis. Welcome.
Thank you. Thank you for having me.
I don't hear much about hepatitis these days. What is the current concerns?
Well, with hepatitis, there's different types of hepatitis. The three most common are hepatitis A, hepatitis B, and hepatitis C. They all affect the liver. They can be viral or bacterial. But the most common that we're seeing now, and the biggest concerns that you're seeing on TV and things like that is about hepatitis C. With hepatitis B, most of our children and all are being vaccinated because it's a requirement to get into school.
Gotcha.
So babies are, if they get their vaccines on time, they're completely covered by the time they're 6-7 months old. Some of us baby boomers weren't given the vaccine, so hopefully people now are going and getting it. Most of them are covered if you have insurance under the preventable care part of your insurance. With hepatitis B, it's a series of 3. You get the first one, a month later you get the second one, 5 months later you get the third one. There's also a vaccine for hepatitis A, which is normally passed through food, bad water, things like that. We still see some in our area. If you remember the outbreak we had last summer with one of our establishments because of some strawberries. With Hep A, it's not as common because we do have good restaurant inspections, our water treatment plants and things like that, not like third world countries where they see a lot. But if you are going to travel, we are recommending hepatitis A, and it's a series of 2. And for babies, we are, it's recommended, it's not required yet, but we are given it a lot of times through their childhood immunization, so they are covered. The one that we're really concerned about is hepatitis C because it does not have a vaccine. We don't have a way to prevent it. And all of, with hepatitis B and hepatitis C, they can be passed through any type of blood and body fluids, through sexual transmission, things like that. And with hepatitis, it can live outside the body. It doesn't die in oxygen, so it can live up to like 3 weeks on surfaces.
Holy cow, so that's pretty transmissible.
It is. It is very contagious. Mm-hmm. It can also be passed through mother-baby. The statistics that I was reading with CDC say about 6 out of 100 babies whose mothers are infected with hepatitis C can be infected. If you have any co-infection with HIV, then that makes it even more dangerous for you. They usually have a lot more health issues as well as more transmissible. So.
Well, honestly, that's mostly when I heard about hepatitis was sort of during the 80s, early 90s, HIV. It was a lot of people who got hepatitis kind of figured that they might, have HIV, and it was a big deal then. And I guess that's probably when the vaccines came out and when we started
especially with hepatitis B. We started in the late 80s or in the 80s given hepatitis B vaccine. With hepatitis C, we're recommending anybody who is a baby boomer, and they're considering, CDC considers 1945 to 1965. People in that age, no matter what your risks are, even if you don't feel like you have any risks, should be tested at least once. You should do it during one of your well checkups if you've never done it before.
Well, and it surprised me. Literally, I was at the doctor this week, and she was recommending it. I'm like, out of the blue, what is this? And she generously said, because of because of the demographic or age range, she didn't say because you're an old baby boomer. She was very nice about it. But still, I was like, that's
weird. Because we weren't testing blood products or parts of blood products back in those days. Because if you received a blood transfusion or if you received any type of blood products, then you're recommended to be tested. Now, if you've even tried any kind of, and I don't want to say illegal, but any kind of injectable drugs, not prescription, but we're talking illegal injectable drugs.
Right.
Even if you only tried it one time, we definitely recommend that you get tested because you are at risk. So anybody who received a blood transfusion before 92 or certain blood products before 87 should be tested. And your doctor would be able to advise you if what your risk factors are. But we do recommend to get tested. Now, if you give blood at the Red Cross or at the Plasma Center, they're going to be doing a screening test on you. So if your blood were to test positive, you would still need to follow up with your primary care doctor because they would do confirmation test.
Okay.
With
Because I do give blood all the time. Nobody's ever raised
right.
a flag, but
and they do test you for that. When you
Okay.
give blood, you're being tested for syphilis, HIV, hepatitis B, hepatitis C, and hepatitis A. You are being tested for those. And they would send you a letter if for some reason something didn't test negative. And then you would not be allowed to give again
Right.
because they would want
of
to.
blood-borne
Even if for some
infections.
reason it was a false positive, they're still going to restrict you for a while for giving just to make sure everything is clear. And they do screen the blood, which is very, very good. But with hepatitis C, the scary part is a lot of people don't have any symptoms.
Well, that's what I was just getting ready
Yes.
to ask. You would think, I would think, you know better, of course, but I would think, if I'm not having any problems, why do I need to be screened?
Well, the different types of hepatitis. Hepatitis A, like I said at the beginning, there are different. Hepatitis A, you usually have an acute phase where you're sick. Hepatitis B, you can have an acute phase of hepatitis B where you get sick for a short period of time and then you become well. And that usually, your incubation period, so if you were to do one of the risk factors and have gotten exposed, then with hepatitis, it could take anywhere from 3 months to up to 6 months before you develop symptoms. So it has a long incubation
wow.
period.
Okay.
So it can be a while. But with hepatitis B and hepatitis A, there is usually an acute phase where you are ill, you get the symptoms. The symptoms are the whites of your eyes turn yellow, your urine turns brown, your stools can be a clay colored, and you feel really, really, really tired. The fatigue is really sets in. With hepatitis C, a lot of times there is not an acute phase. Rarely, there are some people that do have the acute phase, but not many. And people who are exposed to hepatitis C, about 75 to 85% of them, if they are acutely ill, they can go into chronic, where it becomes a long-term illness. And it does damage the liver. And with Hep C, people go into cirrhosis of the liver, cancer, or they actually have liver failure and can die from it.
So there's very serious long-term effects,
Yes,
and
it
you might
is.
not know.
Right.
Chances are you don't know that you have it.
Yes, because you're not having those symptoms. You don't have those acute kind of things that just give you that clue that something's just not right. Your liver could be damaged, but you just may not know it till later, till you really start getting ill.
Right. So this is not, if you have a risk factor, you should go get tested
Right.
pretty soon.
Yes.
But the rest of us at our annual physical, especially if the doctor's drawing blood anyway, there's no reason not to.
Right.
And
you
we
just
really
need
should.
to ask them. But
Hopefully they'll be proactive and suggest it like we did.
And just don't think because you go to the hospital. A lot of people think if they're having their blood drawn that they're getting tested for everything.
Yeah,
and that's
what I
not,
was gonna
and
ask
even with
her. I'm like,
HIV,
why?
they think if they go to the hospital and the ER doctor orders a CBC or whatever for an infection looking.
Which we never understand.
Right.
What
They
all those
think they're
terms are.
testing them for everything.
Yes,
And they're
at my
not.
annual, she's like, she asked specifically about the
Right.
Hep C, and I'm like, well, aren't you testing my blood? Isn't that already in
So
there?
they have to actually put it in there.
They do.
And if you were having some issues with your liver, they have in your blood, when you get certain parts of your blood drawn, you have liver enzymes that they test. And if for some reason those were elevated, then your doctor may do some follow-up to figure out what's causing it. So that may be one of the reasons that you get tested. Now, the tricky thing with hepatitis C is About 25% of the people who are exposed, their body can actually heal them from it, which is very unusual.
Wow.
But you don't know which, if you're in that 25%. So that can be very scary. Don't take the chance. So you want to get tested. You want to find out what your status is. And
so if someone is positive, what does that mean? What happens next? If you know you have it.
If you're positive, your primary care doctor should send you to a specialist. Because if you've seen on television, there are new medications that can, quote, cure you. Everybody cannot be cured from hepatitis C. Those meds only work in certain instances, and you would need the follow-up. We do have some hepatitis C specialists in the area. A lot of your GI specialists, your gastrointestinal specialists, treat people for hepatitis. We also have some clinics. One of them is at EVMS. Another one is up at MCV, VCU up in there. They do have a hepatitis clinic that will help people who do not maybe not have the income or insurance, and they can get help up there if they don't have that. But they would need to be screened, and then if your screening test is positive, they'll do a confirmation test to make sure.
So it's really important because it is a disease that causes a lot of long-term, chronic, very serious problems. Can be treated in any case, and some cases more successfully than others, but there is management, there is control.
Right, and you are contagious. I mean, hepatitis C, you're contagious the rest of your life. So just like any viruses, there's no cure for viruses. So you are contagious. So if you are sexually active, you need to use protection, you need to use condoms. If you are a mother or of childbearing age and you think about you want to have children, you need to discuss that with your OB and see what the risks are, and really follow up with that. So there are a lot of consequences. A lot of people want to know about tattooing, body piercing, things like that. If you're doing it, if you're getting one done in a professional setting where they are using the proper cleaning and handling of the equipment and things like that, you should be okay. Hepatitis C shouldn't be a big risk. But if you are choosing to do it in somebody's garage or at somebody's home or not using using very poor hygiene, then there is that possibility because, again, we talked about hepatitis can live outside the body. So if there are any blood products or anything like that outside of the body, say if there was a spill or if somebody, God forbid, got shot or something like that and there's blood available and you have a cut or access into your body, there is a possibility. So you want to, still protect yourself.
Okay. And protect those around you.
Yes, yes.
That's the other important.
Yes. You cannot get it from like hugging or kissing or anything like that. You want to be careful using personal items like razors, toothbrushes, things like that, because there's also a possibility of blood.
Okay.
So just normal, though, handshaking, things like that, you're not going to get it that way. So
okay. And so for most of us, we'll get the negative, we'll know it, and that'll be great. And for the rest of us, we need to follow up.
Yes, because there are treatments available to help people stay healthy, to help them feel better, and to try to at least slow down the disease process. So if your liver was having issues, if it was starting to have cirrhosis or liver failure, those medications can help slow it down some. So
okay. Well, thank you, Nancy.
You are welcome. You are welcome. Thank you for having me.
And this was perfect timing because I did get screened this week, and I hope that those of you who have risk factors of a certain age, we won't mention what age, but ask your doctor if you should be screened and suggest that happen. And if you have any questions, again, there's the health department, but be careful about hepatitis and go for your screenings. Thank you for watching.